So we'd like to call the next speaker, Dr. Abinaya Valliappan, and she'll be speaking on the effect of aurolab, aqueous drainage device implantation and trap on corneal endothelium and anterior chamber inflammation, a prospective randomized open-label blinded endpoint study. And Dr. Sushmita Kaushik will be the discussant for this presentation.
I am the co-guide for this thesis.
Oh.
let Dr. Harsh.
हाँ नहीं आप लोग यार आप जो जज है वो अनबायस्ड.
Can I start?
Please start now.
Yes. Good evening, everyone. I would like to talk on my dissertation, which was on the effect of aurolab aqueous drainage device implantation and trabeculectomy on corneal endothelium and anterior chamber flare, which was a probe study. So, as we all know, nowadays glaucoma shunts are also preferred as primary surgical procedure, and ARC30 is gaining popularity because of its affordability, comparable IOP reduction with BGI and Ahmed glaucoma valve, and indigenous manufacturing. But the Lacunay literature lies on the corneal endothelium focusing and anterior chamber inflammation. So hence the objectives of my study were to evaluate the change in corneal endothelial cell density and fluctuations in AC flare in trabeculectomy and ARC30 in comparison between the two, with secondary objectives of any glaucoma surgery, that is the IOP reduction and complications. This was conducted for a period of 1 year at Glaucoma Clinic Advanced Eye Center, and salient exclusion criteria included complicated cataract surgery, corneal endothelial disorders, secondary glaucoma, and retinal disorders. Once the patients were randomized into the two groups, 5 visits were taken: preoperative, post-op day 1 week, 1 month, and 3 months. Important points to note is that the specular non-contact microscopy was done in 5 quadrants in all the patients, and in the ARC30 group, all the patients tube was placed in the supratemporal quadrant. The outcomes in the IOP were classified based on complete, qualified, and failure based on reduction of IOP with or without use of anti-glaucoma medication. Coming to the results, 21 subjects in each group of comparable baseline characteristics were included in the study, and the effects on corneal endothelium were taken into these 3 criteria. The mean corneal endothelial density values, as you can see in the table between the two groups, and the vertical line showing between pre-op to post-op day 3 months, and the yellow ones highlighted show the significant values which showed changes from the baseline. So between the two groups, at the end of 3 months, there was no statistical significance between in the mean corneal endothelial cell density. Coming to the mean percentage of hexagonality values, the ARC30 group had significant hexagonality loss in the supratemporal quadrant where the tube was placed at post-op day 1 month, and 3 months. Coming to the mean coefficient of variation, though there were significant changes in the coefficient of variation till 1 month in ARC30 group, by the end of 3 months, it had normalized, and both the groups showed no statistical significance as compared to baseline. The AC flare values were persistently high in all post-op visits as compared to the baseline in both the groups, but the mean rise in flare was more in the trabeculectomy group at post-op day 1 month and 3 months. The mean IOP was successfully reduced in all the post-operative visits in both the groups, but the need for anti-glaucoma medication was more in the ARC30 group at the end of first week due to hypertensive phase, and at 3 months in trabeculectomy group. Coming to the ASOCT, the tube corneal endothelial distance between the tube corneal endothelial distance was correlating with the supratemporal corneal endothelial cell density value readings only at the first week in the ARC30 group. Early and late complications between the two groups were comparable, though the need for secondary procedures were significantly more in the trabeculectomy group as compared to the ARC30 group. Correlation studies were performed where age of the subject and tube corneal endothelial distance were found to significantly associate with the CECD value till 1 week in the ARC30 group, whereas no such correlations were found in the trabeculectomy group. These findings were concurrent with available literature in terms of AGV and BGI in the corneal endothelium aspect, and the IOP reduction in ARC30 which has been performed previous studies. One salient point in our study was that of 3 patients due to choroidals were on a short course of steroids, which might have caused a transient decrease in the AC flare and might have affected the flare comparison between the two groups. Coming to the conclusions, there was no significant variation in the CECD loss, IOP reduction, and flare between the two groups, apart from the persistent hexagonality loss in the superior temporal quadrant in the ARC30 group where the tube was placed. ADI can be safely considered as a primary option. These are the merits and demerits of my study. I would like to acknowledge my mentors and AIO's ARC team for giving me this opportunity. Thank you.
Thank you, Beta. Excellent presentation.
Thank you so much.
And well in time. I think you're the first one well in time.
Thank you, sir.
And I'm a little confused. Ari, why do you think there is an option in India to do valve as a primary procedure?
Sir, no, sir. I mean,
Well, the
not
comparison
for all.
has been done thinking what? Because normally you could have compared with another valve or something. Maybe that would
Sir,
have been.
such-
And were all the surgeries done by one surgeon?
No, sir. That is a limitation of our study. With 3 surgeons who were performing the surgeries. There were
No,
3
but just
glaucoma
tell me the
surgeons who had
thought
performed.
process about, because to the best of my knowledge, we do valves when traps
Are failing,
Yeah.
yes, sir. So there are a few studies, and I mean there are a few editorials which do say that we between when there is a question between trap and
Because
tube
one of the things you
surgeries, we
said
can-
was that it is less expensive
than
as
the other
compared
available
than the
valves.
available thing.
Yes, sir.
And
So
then
we
you are
would-
comparing with trap, which is free.
Yes, sir. But I would like to say this is we have taken trap because that is the gold, like the first gold standard surgery which we do for filtration aspect. But since trap versus tube study has been done, similar studies have been done with other valves. We wanted to have a take on it with the indigenous valves. So
Okay.
that was one of the ideas which we had when we had to take up
Can
the
I ask
topic
a
for
question?
the
Please, please.
dissertation.
Very excellent presentation.
Thank you so
Yeah,
much.
a good presentation,
Thank you,
but
ma'am.
I have one major question.
Yes.
If you want to really know what happens to the endothelium, do you think 3 months is enough?
No, no, ma'am. That is one other limitation of my study.
Yeah.
And longer follow-up is needed.
Okay, and all the Adi were primary?
All the
pri-
other were primary.
Never
ma'am.
had any
No,
surgery
ma'am.
before.
We had excluded, ma'am.
Okay.
It was-
The third question was the length of the tube
Yes, ma'am.
inserted was measured and it was
Yes,
the same
ma'am.
in all patients?
Yes, ma'am. It
Okay.
was
Okay.
measured to be 2.4 mm from the limbus.
Okay.
And entry.
Thank you.
Thank
Good
you.
work. Don't worry, we'll catch the other people who have given the topic.
Thank you very
sir.
much.
Thank you, ma'am. Thank you.